Hello, good day. How are you? I'm hoping that you are doing fine despite of everything that is happening in our current generation. Today, let us try to be productive by studying a peculiar yet an intriguing topic about a certain genetic disorder. And we need to make sure to fulfill our objectives at the end of the discussion, wherein you, as learner, must be able to assimilate comprehensive information regarding the Proteus syndrome, identify the signs and manifestations of the disorder, understand the genetic mutation that affects a Proteus syndrome patient, discern the different diagnostic tests and considerations for Proteus syndrome, know about the possible treatments, and understand and practice the different ways on how to manage the Proteus syndrome, differentiate Proteus syndrome to other genetic disorders, identify the facts and debunk the myths about Proteus syndrome, and of course, be knowledgeable about the organizations and institutions that specializes in handling the Proteus syndrome. As you can see in our first slide, one of the first pictures that you will see when you search for the Proteus syndrome is the image of a man with the distinct physical characteristics compared to a normal person. This man is known as the Elephant Man. He is Mr. Joseph Merrick of the Victorian times, known to be the first person who acquired the Proteus syndrome. By the way, I am Marius Miguel Vismonte, your nurse educator for today, and I welcome you to our discussion regarding the Proteus syndrome, a rare genetic disorder. I know that the first question that comes into your mind is the question that, what is Proteus syndrome? In this phase, we are going to tackle the description of the Proteus syndrome as well as the etiology of its name. To start, Proteus syndrome is a rare condition. It is characterized by overgrowth of the bone, skin, and other tissues, according to the National Library of Medicine. It is a disorder of patchy or mosaic postnatal overgrowth of a known etiology, according to Dr. Leslie Baysecker. When we say patchy or mosaic, there are several manifestations that can be seen in your body, be it on your arm, legs, or everywhere. It is a disease wherein organs and tissues affected grow out of proportion to the rest of the body. Hence, the overgrowth is usually asymmetric. Overgrowths can be mild or severe, and they can affect any part of the body. The limbs, spine, and skull are commonly affected. When we say the word asymmetric, there is no balance of overgrowth. Sometimes the right side can be bigger on the left or vice versa. However, these overgrowths are not cancerous, so it means that there is nothing to worry about regarding with cancer. Now, we are moving on with the etiology of the name Proteus syndrome. It was first described as a discrete clinical entity in 1979 and assigned its name several years later. The term Proteus syndrome, it was first coined by Weidenman et al. In 1983 to describe a disorder of skeletal, hamartomus, and other mesodermal malformations. The syndrome was named after the Greek god Proteus, which means polymorphous. When we say polymorphous, it is defined as occurring in or having many forms or shapes or appearances, as evident by the appearance of what a Proteus syndrome patient looks like. Also, this syndrome is known with the names hemihypertrophy, macrocephaly, partial gigantism of hands and feet, and of course, the elephant man's disease. Now that we're able to define and understand what Proteus syndrome is like, we are now moving on to the next phase of our discussion, which focuses on the signs and manifestations of the Proteus syndrome. To sum everything up, there are two general features of Proteus syndrome. Number one, the disorder primarily manifests as postnatal overgrowth with irregular, distorting of many tissues. In this characteristic, let me highlight the word postnatal. When we say postnatal, most patients with Proteus syndrome are born without significant asymmetry, and the asymmetric overgrowth starts in 6 to 18 months age range. This simply means that it doesn't have an early onset of signs and manifestations. It takes 6 to 18 months for the signs to be present on the patient. It is followed by the next characteristic, which is that Proteus syndrome is rapidly progressive. The manifestations of the Proteus syndrome apparently can include any tissue of the body. There is no limitation, that is why it is continuous. Despite of the varying manifestations of every Proteus syndrome patients, 80 to 99% of people with this disease or syndrome may have the symptoms. Number 1. Abnormal form of the vertebral bodies. Most of the patients display a disfiguration on their vertebral columns. It is manifested by scoliosis, for an example. Next is that the abnormal subcutaneous fat tissue distribution. The manifestation of the Proteus syndrome apparently can include any tissue of the body, and it is normal that the fat tissue is included with that. And most affected parts of the body are the arms, the legs, and many more. Next is the arteriovenous malformation. When we say the word arteriovenous malformation, it is an abnormal tangle of blood vessels that connects arteries and veins, which disrupts normal blood flow and the oxygen circulation. It is quite alarming because we know how blood vessels work in supplying oxygen in all parts of our body. The next manifestation is that the asymmetry of the thorax. When we say the word thorax, it pertains to our chest part. Next is, of course, the cachexia. When we say this word, it is the weakness and wasting of the body due to the severe chronic illness. And lastly, the non-cancerous tumors often found on the ovaries and membranes that cover the brain and the spinal cord. This can be disfiguring and lead to several mobility issues. Tumors can compress organs and nerves, resulting in things like a collapsed lung and loss of sensation in a limb. Overgrowth of bone can also lead to the loss of mobility. Proteus syndrome can cause numerous complications. Some can be life-threatening. The growths can also cause neurological complications that may affect mental development and lead to the loss of vision and seizures. Right after knowing the signs and manifestations of the Proteus syndrome, it is now time for us to move on to the next phase, which focuses on the genetic mutation of the Proteus syndrome. When we say genetic mutation, it is the alteration of genes in the normal gene structure of our bodies. In the case of the Proteus syndrome, it is mutated by the AKT1 gene. As you can see in the structure, the AKT1 is located at the center of the genetic structure. It is a type of mutation wherein it disrupts a cell's ability to regulate its own growth, allowing it to grow and divide abnormally. These mutations are not inherited from the parent, but arise randomly in one cell during the early stages of development before birth. Doctor suspects that it is random and not inherited. The mutated gene makes an abnormal protein that is thought to increase the rates of cell growth and may prevent cells from dying off when they naturally would. And at this point of time, no one really knows why this mutation occurs. It is now time for us to know the ways, procedures, and considerations to diagnose Proteus syndrome. Diagnosing this genetic disorder is difficult in some ways because the condition is rare and many doctors are still unfamiliar to it. Thankfully, there are three general characteristics or features that can be used by health practitioners like doctors to consider a diagnosis for a Proteus syndrome patient. The first factor is the mosaic distribution. This means that the areas of overgrowth are patchy and that only some body parts show signs of overgrowth while others are unaffected. It simply means that the spread of the disease is not present in the whole body. It is only selected in some parts wherein it is excluded and asymmetrical with the other part. The next feature or characteristic that can be considered is the sporadic occurrence. This means that no one else in the affected person's family has similar features of overgrowth. It simply means that the patient has it is a new record of disorder in their family. The last consideration is the progressive course. This means that the overgrowth has noticeably altered the appearance of the affected body parts over the time or that new areas of overgrowth. So it simply means that it is related with the continuous production of protein by the genetic mutation caused in the AKT1 gene. Now we are moving on to the ways and procedures wherein it can help in diagnosing the Proteus syndrome. In this part of the lesson, you can see the diagnostic tests, procedures that can be used in determining the features and factors that can be considered in order to diagnose a patient with Proteus syndrome. These methods and procedures are proposed by the Genetic and Rare Diseases Information Center during the year 2017. The first one is physical evaluation. Next is the imaging tests, blood work, tissue biopsies, and the genetic testing. At this juncture, we are going to talk about different ways on how to treat and manage Proteus syndrome. We're going to discuss 3 subtopics wherein it will help us in the process of treatment and management. To start with, we have number 1, require individualized treatment. We all know that each Proteus syndrome patient has their own unique manifestations. Therefore, they will have different medical needs. That's why it is very important to have unique and tailor-suited plans that is appropriate to address all the problems of a certain patient. Now we have number 2, the developmental intervention. It is suggested for developmental delays because any organ or tissue can be affected. The patient should be monitored for any possible complications. We all know that one of the main characteristics and features of the Proteus syndrome is its rapid progressiveness. That's why this part is very important. And lastly, which is the sad truth, there is no cure for Proteus syndrome. These treatments generally focuses on minimizing and managing the symptoms. So, studying these kind of genetic disorders is really important in our time so that we can gather and collect data which will be helpful for us in devising ways on how to treat this type of disorders in the near future. I know that I have mentioned that Proteus syndrome is so rare, but how rare is it? Now we are going to talk about the rarity of the Proteus syndrome. This uncommon syndrome is reported with an incidence of less than 1 case per 1 million population, according to Lindhurst in 2011. Now that we're near to the end of our lesson, we're now going to identify the facts and debunk the myths of the Proteus syndrome. To begin with, we're going to tackle the facts. Number 1. Proteus syndrome is an extremely rare and overdiagnosed disorder of mosaic growth dysregulation primarily involving overgrowth. Yes, this is true. We have discovered that Proteus syndrome is an extremely rare disease or disorder with less than 1 per million. And at the same time, it is characterized by its mosaic or patchy nature, which refers to its emergence in certain parts of the body. Now, number 2, the disorder is thought to be caused by a somatic genetic alteration but the etiology is unknown. We have discovered that the Proteus syndrome is caused by the ATK1 gene that is altered or mutated. Yes, that is the cause of it, but we don't know what is the cause of that alteration in the gene. So we're still trying to figure things out on how did it happen. For number three, clinical diagnosis for Proteus syndrome is challenging and controversial. Number one, challenging, yes, because it seems to be new to everyone, especially for us medical practitioners, and we're still figuring things out on how to treat such disease. And of course, it is controversial because it is something new and everyone is unfamiliar to it. Patients are prone to judgment and also confidential at the same time because they are unique. They have unique manifestations based on their condition. Now we are moving on with debunking the myths. Number one, although there is no cure for Proteus syndrome, it is not contagious. So it is often misconcepted that things or diseases like this are contagious and can spread to everyone. But no, it will never be because it is just focused on the genetic alteration manifested on a certain individual and will never be transmitted to anyone. Hence, let us avoid discrimination and let us provide a healthy patient advocate environment for them. And then number two, it is not caused by factors that the parents did or did not do. It just occurs randomly. So let us remove the common misconceptions that problems like this arise because of the negligence of the parents or their overreaction on some things. But no, it is just a random occurrence that happens in the genetic structure of an individual. And we're still sorting things out on how it happened. And hopefully, in the near future, we can resolve and answer the questions why and how it happened. It is also important for us to know the organizations and institutions which specializes in treating and management of the Proteus syndrome. In my list, there are three main organizations and institutions. To begin, we have the Genetic and Rare Diseases. It is a group of network where Proteus syndrome and other genetic disorders are studied and well addressed. Also, we have a specific institution for the Proteus syndrome, which is the Proteus Syndrome Foundation, which is located at the Colorado Springs in the United States, and of course, the National Institutes of Health, their clinical center for Proteus syndrome. You can read the reference list, which shows the sources that I have used for this discussion. I would like to thank you for being here with me today, and I hope that I have shared enough and adequate knowledge which can help you in understanding genetic disorders like the Proteus syndrome. Once again, I am Marius Miguel C. Vismonte, ut in omnibus glorificetur Deus. God bless you all. In the words of the former South African President Nelson Mandela, let us all remember that education is the most powerful weapon that you can use to change the world.